For most women, being pregnant is the experience of a lifetime. But when it comes to prenatal care, many don't know that a doctor of chiropractic can help with the aches and pains as a woman's posture changes during pregnancy. Dr. Laura Tanis is a chiropractor specializing in pediatric and pregnancy care.
As the body changes during pregnancy, the head, spine, and pelvis can become biomechanically stressed. Chiropractic care provides gentle and effective adjustments to relieve headaches, neck, and back pain, all without medication.
This is especially important since a UCLA study found that the drug, acetaminophen, if taken during pregnancy, has been associated with a higher risk in children with attention deficit hyperactivity disorder, or ADHD.
A specific postural and spinal evaluation combined with appropriate treatment can establish balance within the pregnant woman's pelvis. This helps reduce unwanted stress to the uterus and the supporting ligaments.
For a healthier pregnancy, more women are discovering that chiropractic care delivers. For more information, visit yestochiropractic.org.